And good afternoon, everyone. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions and addresses the latest COVID news every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 27th of January. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Sophie Buskowski, who is a student research assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Morning.
So in the United States, we had about 686,000 new COVID cases. So while the 7-day average is slowly decreasing, what we are finding is that hospitalizations are still hitting peaks. And unfortunately, we saw the highest death rate number since winter's last peak. We saw about 3,895 people die of COVID yesterday. In Illinois, we are slowly seeing a decrease, although the death rate has also increased by 40%. Yesterday in Illinois, we saw 15,723,000 new COVID cases. We're still seeing a 7-day average of about 22 to 24,000 positive cases per day, which is still incredibly high. What can you tell us about this death number that we saw yesterday in the United States being so high?
Yeah, no, this is totally expected because this is what happens. You get exposed, you get infected about a week later, you get over it, or you get really sick a week after that. So that puts you at 2 weeks. The ones who get really sick end up in the hospital. The average stay, 5 to 8 days, mostly they're out, but there's a bunch of them that end up in the ICU, and a bunch of them unfortunately pass away. So you do that whole line, and the death is occurring in people that were diagnosed really 3 to 8 weeks ago.
Right.
So that's why the death rate is, that'll be the last thing to improve. When you see that death rate go down, you know that the whole wave is really pretty much past.
Right, no, definitely.
Yeah.
You know, speaking of pushing down the death rate, despite CDC directive, many pharmacies are refusing to give people 4 shots, especially those that are immunocompromised. What can you tell us about pharmacies that are turning away individuals who need a 4th shot?
It's really a travesty. 4th shot is approved for immunocompromised people. The pharmacists are not doctors, medical doctors. Not that they can't figure out who's immunocompromised or not, but why are they questioning? There is no mandate that says you have to have a doctor's prescription. They're supposed to go right to the pharmacy to get these shots, or right to a clinic, whatever is giving it. And to sit there and have, a pharmacist question you, this has happened to several of my patients, so I'm telling you a true story. To sit there question somebody about their immunocompromised status in front of other people. It's totally inappropriate. Now that, of course, doesn't happen everywhere, but that has happened to 2 of my patients. It's just inappropriate. I mean, give the shot. If the patient is signing an attestation statement, that should be good enough.
No, absolutely. It's very sad, especially 7 million people in the United States is immunocompromised. Yep. It's a large number. Our second big headline is that, yes, you can catch flu and COVID, but no, flurona is not real.
No.
What can you tell us about this story that was sort of picked up?
I mean, it sounds nice, flurona. It sounds like my flurona, it's not real. You get one infection or the other, very rarely, maybe once in a million times, you can have them both at the same time. That really doesn't occur very often. It's just not true.
Wonderful. And now those were all of our COVID headlines. And now for some COVID questions.
Okay, wait, I have to take a break real quick. There's a guy at my front door. So
totally.
Please stop this. Questions.
Okay, now for some COVID questions. For our first question, can Omicron be the paving way to herd immunity, Dr. Murphy?
Well, it's possible. I mean, ultimately, that is going to happen. People are going to go through immunity from their vaccines, their boosters, revised vaccines. Getting COVID is like a vaccine, sort of. This is going to cycle. And ultimately, the population will get enough immunity that it will become an endemic disease, like influenza now.
Right.
So
Yeah.
we don't know if Omicron is the one that's going to make or break this, but it's going to add to that. And the number of people getting infected is so great that a lot of people are exposed and getting some immunity from Omicron. We don't know how good that immunity is yet.
Well, for our second COVID question, this individual would like to better understand if there are different risks for people with type 1 versus type 2 diabetes when it comes to COVID-19 infections.
Well, all diabetes is a risk for a high risk for COVID. I mean, COVID, high risk for severe disease. That's for sure. There was a paper out this morning, study in 200 people that were followed longitudinally, and for long COVID symptoms at 3 months or more, they're one of the risk factors. There were 4 risk factors for long COVID. Viral load being high. That's important because now we have antiviral drugs.
Mm-hmm.
Just like with HIV, high viral load is also a bad thing.
Mm-hmm.
So we can maybe treat the viral loads, which occurs early in the infection. Autoantibodies, these are antibodies that your body makes against the virus, but also attacks your body. Like the same kind of things that happen with rheumatoid arthritis and lupus and things like that. Diabetes type 2, the one more in older people and people overweight. That's a risk factor, as is reactivated Epstein-Barr virus. So those 4 things were associated with long COVID. But just for severe disease, any diabetes.
Wow. And now for our third COVID question. Dr. Murphy, can you explain why a fully vaccinated person, in this case with triple Pfizer, should not be socializing with an unvaccinated person? I know we've talked about this so many times.
Yeah. The reason is that, a vaccinated person can get COVID.
Right.
They typically don't get severe disease, but getting COVID is no picnic. And then that just keeps the whole epidemic going. So the unvaccinated people are so much more likely to have COVID. And they also typically have higher viral loads. They're actually more infectious. So they're just too high risk to be around. They're the ones really driving the epidemic at this time in the United States and many of the countries.
Right, absolutely. And for our last COVID question, this is a great question. This individual is a little confused about the take-home tests because they're not being reported. So are the numbers really low compared to what they actually should be if we reported all take-home tests, Dr. Murphy?
Well, they're not being reported, that's for sure. So many people are doing these COVID tests, and a couple things are happening. One, they're having mild disease and they're just staying home. It's not reported. 2, they're going to get a confirmatory test at a laboratory. That will get reported. The confirmatory tests are reported. You go to a CLIA certified laboratory, the test is reported. But some of them may be false positives. Some are false negatives, some are just negative negatives. So, but I've talked with some of the health officials here in the state. They don't want to get into it. They got better things they can do with their time. Let's just face it, whatever numbers you're reporting, you have to basically inflate them to account for the people that aren't picked up with the home tests. Now, if somebody with a home test positive gets really sick, ends up in the hospital, they're going to get confirmed with a test that is reported.
Right.
So the severe disease will get reported, but they just don't have the resources and don't think it's worthwhile. They would rather be working on other parts of the pandemic and getting the vaccines out there and getting people treated and well. It's just
what I'm hearing is the numbers are much lower than what we think that they are.
But there are some jurisdictions. It's up to the health department. There are some jurisdictions in the United States I've read about, none that I know personally, but I've read about them. In Ohio, I know there's one that they do ask people that if they do test positive, to actually voluntarily report their results. So somebody somewhere may be doing it, but it's not uniform across the United States, and people, they just don't want to, just don't think that large effort is worth it. I mean, look how many millions of those tests are being done every day. You're going to report negatives, you're going to report positives only, you know, so probably just positives, but it's just not going to happen.
Right, understandably. Well,
And all it is going to do, all that would do, it would take a huge amount of manpower to actually collate all the data. For what? Okay, the number's worse. It's worse than what is being reported. So
right.
it's bad enough.
No, absolutely.
Well,
Well,
it's getting better.
hopefully, fingers crossed.
Yeah.
Well, those are all of our COVID questions for today. Thank you so much, Dr. Murphy.
Great. Thank you.